Taste and aging. How does our taste change as we age? There are five basic tastes: sweet, salty, sour, bitter, and umami. Do we stop tasting specific tastes as we age? Or any taste in specific change in its threshold? I would like to start my presentation by discussing about the mechanism of gustation or taste. There are thousands of taste buds distributed along tongue. There are three types of papilla: circumvallate, foliate, fungiform papilla, and each has taste buds in it. And circumvallate papilla consists thousands of taste buds, and foliate papilla has hundreds of taste buds, which is distributed on the posterior lateral aspect of tongue, and on the dorsal tongue, fungiform papilla, which consists few taste bud in each papilla. In taste buds, there are taste receptor cells, which is kind of reaching out for a compound that can bind to it so it can transmit the signal of taste. It can be a G protein coupled receptor, GPCRs, or it can be a sodium channel or a proton channel, which can trigger the taste sensation. So as I said, there are five basic tastes. Gustation is the sensory modality generated when chemicals activate oral taste buds and transmit signals to a specific region of the brainstem. So spice, or the hotness, or the coolness or minty taste, is not considered as a basic taste because it does not bind to a certain receptor or go through a channel. Its sensation is triggered by a somatosensory nerve fibers, which is the same fiber that transmits pain. So within the five basic tastes, umami, bitter, and sweet has a specific GPCR or G protein coupled receptor, which will bind to a certain molecule to trigger umami, bitter, or salty sensation. In comparison, salty or sour sensation is caused by a molecule or ion passing through the channel. In salt, it's just a sodium channel, and sour is a proton sensitive channel which will detect the pH of the environment. Also, now there is a discussion to add fatty taste to a basic taste because now they are starting to find a specific receptor that binds to this fat molecule. So all these receptors and molecules activate the taste receptor cells and transmit signals to a higher sense. This is a first order neuron, either a glossopharyngeal nerve or facial nerve, chorda tympani, binding or synapsing to a second order neuron in the nucleus of solitary tract and gustatory area. The second order neuron will travel up to thalamus, and a third order neuron will then bring the signal to gustatory cortex, which is found in anterior insular frontal operculum. There are four specific taste receptor cells, type 1 to type 4. Type 4 is just like a basal cell that binds together, or a undifferentiated cell that has a potential to become type 1, 2, or 3. So it's like a stem cell. Now, there are yet to study or to be discovered more about these different types of cells, but type 1 cell is thought to be like a glial cell in CNS, which controls the activity of type 2 or type 3 cells. But there's a hypothesis that also transmits salty taste. Now, sweet, umami, bitter, which has a GPCR to trigger, is transmitted from type 2 taste receptor cells, and sourness is transmitted from type 3 cells. Now, taste and aging. There's a study that was performed using mice. They compared 2 months old, 10 months old, and 18 months old mice. Surprisingly, there were no significant difference in the number of taste buds. However, they found significant reduction in its taste bud size, and also in the number of taste receptor cells per taste bud in 18 months old mice compared to 10 months olds. Surprisingly, there were no significant changes in taste responsivity of sour, salty, or bitterness between 10 months old and 18 months old. However, they found a significant reduction in a sweetness sensation. So, what do we see in human studies? There's no significant correlation between age and the number of taste buds, or a taste bud density in different age. So it is same as we saw in mice. There's a decrease in taste bud size and taste receptor cell density in older patients compared with younger groups. So this is also similar findings that we saw in mice too. Significant differences were found in both sweetness detection and recognition thresholds between different tastes in young and older adults. And the elderly required 4.7 times more molecules or ions to detect and recognize a taste hint. So, as you can see, there is a higher threshold of detecting or triggering these taste receptor cells. Now, olfactory impairment is commonly seen in older patients, as well as reduction in saliva production. And these two plays an important role in the hypogeusia, which is decrease in taste. In previous slides, I mentioned that taste receptor cells bind to a water-soluble molecules or ions. And if there is less saliva, maybe from systemic condition or the medication that elder patients are taking, will significantly decrease the fluid that may melt or dissolve the molecules or ions into those fluid. So there will be less triggers that can activate taste receptor cells. So literature suggests that overall threshold of all tastes rise as we age. And also it will be harder to distinguish different tastes. It appears to be change in taste is multidimensional from concentration of taste receptor cells in each taste bud or olfactory impairment and to most importantly reduction in saliva production because taste receptor cells binds with water soluble molecules.